Hello everyone, and welcome to the fourth and final session of the Nordic Council of Ministers virtual conference, Sustainable Integration in the Nordic countries in the face of COVID-19. What are we learning? This week has brought experts, professionals and practitioners together from Nordic and European national ministries and agencies, regions and municipals, as well as from civil society and research. Today, we're continuing by bringing together conversations around different themes in this plenary session. My name is Emily Cochran-Beck. I'm Senior Consultant in Ramble's Department on Social and Economic Impacts based in Denmark, and I'll be moderating the session today. Now I'd like to introduce Anna-Maria Mosekilde, Project Consultant at the Nordic Council of Ministers, to say a few words of welcome as well.
Thank you, Emily, and good afternoon to everyone. On behalf of the Nordic Council of Ministers, I would like to extend a warm welcome to you as participants and also as presenters in today's plenary session on sustainable integration. As Emily said, in the past 3 days, experts from across the Nordic region have shared what they have learned about integration since the outbreak of COVID-19. We have learned that the pandemic has had a more severe impact on some minority communities, but also how outreach to and mobilization of the very same communities has initiated novel forms of cooperation between sectors and also strengthened the cooperation between municipalities and representatives of minority communities. We've also learned that in some areas it has been difficult to maintain the same contact with minority groups, for example, when it comes to language training, while others have developed new language teaching methods on digital platforms, ensuring that newly arrived have not lost their language skills during this time. And at the same time, they have also strengthened their IT skills. Today, we are honored to have experts and political leaders join us from across the Nordic region and reflect on what we have learned in terms of labor market integration, housing inequality, and transcultural communication. We will address some of the most urgent challenges in the Nordic region in terms of integration and also reflect on possible solutions. I would finally like to encourage you all to engage with the panelists in today's session by using the chat function on the platform. Please ask questions and comment on the presentations. Thank you.
Thank you, Anna-Maria. We're really pleased to have all of you with us today. We have over 140 people registered for the event from all 5 Nordic countries, as well as from Germany, the Baltics, and from other European countries. And now, just to help us all get engaged a bit, we want to ask you each to just answer a quick small survey we have here so we can get a sense of who's in the session together. So you'll see it coming on your screen now. And if you could just take a moment to go ahead and answer which type of organization you work for, we'll give it just a minute so everyone can respond. Great, thanks very much. So let's see the results. So here you can see here that we have quite a number of different people, and they're both coming from national ministries and agencies, from the regional municipal level, from civil society, from research, and also a number from other kinds of organizations. Today on our program, we're going to spend the first hour hearing from researchers from Norway, Sweden, Denmark, and Germany. The researchers will have about 15 minutes apiece, and then we'll follow that with a panel discussion among them. Then we'll take a short break, which will run approximately 13:55 to about 14:10 Central European Time. And then the second hour we'll spend hearing from leaders from Helsinki, Aarhus, and Oslo, followed by a panel discussion with them. I want to make a note here and say that you can download the full and updated program for today's session under the Handouts tab in your GoToWebinar interface there. And along the way, as Anna-Maria mentioned, you're welcome to pose written questions to the speakers and the panelists using the questions box within the same interface. And we'll do as much as we can to work some of these questions into our panels. So now I'd like to introduce the first speaker who will speak to you, and that is Vilde Hernes, who is a researcher from the Norwegian Institute for Urban and Regional Research at Oslo Met. Welcome, Vilde.
Thank you. What happens to the integration process when society locks down? What happens to the social integration when we are encouraged by the government to only choose 1 to 2 friends to hug and only to interact with a selected 5 people during 1 week? Is this the moment when the cold people of the North finally open their homes and do not prioritize their closest friends and families, but the time where we think about including the newly arrived neighbor down the street that barely speaks the language? What happens to the integration process when unemployment levels reach a historical high and many businesses are restricted to operate as normal or restricted to operate at all? Is this the time when employers take the extra risk they feel it is to hire somebody that is just establishing themselves at Nordic employment markets? What happens to the regular elements in the integration process, from language courses, employment practice, education measures, and social inclusion into civil society? In a time where regular employees are mandated to work from home, is this the time when employers open their office to a person in need of language practice? So what happens to the integration process when society locks down? The purpose of this introduction is not to paint a picture of us Northerners as a cold and unfriendly people, because we have all gone through a strange year where many have had their world turned upside down financially, socially, professionally, and medically. Many of you following today working with integration have already felt the many challenges this new situation has entailed. And we come together at this seminar to share and learn about potential challenges and solutions across countries. However, as most of you probably have felt in your everyday work life, the integration process has become even more challenging since the lockdown in March. And these challenges will most likely continue until our populations are vaccinated, and probably a lot longer. Exactly how the integration process has been affected by the corona situation in the Nordic countries, we do not know yet, even though the sessions the last couple of days have given some preliminary insights. Thus, I will not be able to provide you a definite answer as to how the labor market integration will be affected by the pandemic. But based on what we know from earlier research, the Nordic Council of Ministers have asked me to present what I will call a qualified guess or some predictions concerning the challenges we face, and hopefully some sparkle of hope for some positive side effects this challenging situation may produce. For the ones who attended the seminar last year may remember that I presented a new report financed by the Council and written together with Trond Starendt and Jon Andersen, where we compared education and employment patterns for newly arrived refugees in Norway, Denmark, and Sweden. So my assignment from the Nordic Council of Ministers from this presentation was to revisit and relate some of the main findings from this report, and more generally, what we know from research and what we have learned from the sessions the last couple of days, and relate this to our current and future situation. So I will build this presentation on main findings from this report, a new article my co-authors of the report and I published, and a new report on the corona situation and how that has affected immigrants by the OECD. And I will mainly focus on labor market integration and elements in the integration program for refugees. So what do we know? What insights may we derive from previous and new research? Although there are some differences between countries, for example, as we heard from Finland yesterday, what is often the fact is that during financial recessions, immigrants are disproportionately affected. We've seen this in studies of the financial crisis, and there are several reasons for this. Immigrants are more often on temporary contracts. They work in cyclical sectors. They often have lower seniority. The last in is the first one out. And as newcomers, they have fewer networks. This is important generally, but particularly in recessions. And during recessions, employers are often more selective and less risk averting, or they are risk averting. In addition, the corona crisis particularly affects immigrants because the main sectors they are often employed in are hit particularly hard, as the hospitality sector. Additionally, they are also often overrepresented as self-employed, and especially small businesses with low capital stocks in the hospitality sector, which make them particularly hit by this crisis. So there are several challenges for labor market integration of immigrants in general. But what about the newcomers, particularly newly arrived refugees? We could also expect that this group will be hit particularly hard because studies show that persons who do not get employed the initial years more often experience long-term employment. So this is painting a rather dark picture of the situation. And I'm not going to lie, it is severely challenging. But let's take one step back and look at the existing toolbox for newly arrived refugees and whether this toolbox may or may not be useful in today's situation. So what have we done before? The Nordic countries have integration programs for newly arrived refugees the first years after settlement. The main goal of Nordic integration programs is to ensure self-sufficiency and labor market integration for the target group, refugees and persons family reunited with the refugees. And this program has mainly consisted of two pillars. Number one, language training, and number two, education and/or employment measures. So how may these measures work in today's situation? Taking the first pillar first, language training. Under the lockdown, we now know that language training for adults were often either cancelled or moved digitally. And we have all read about the challenges with suddenly turning general education for our kids and high school digital. But many of the groups in the integration programs have low literacy and computer skills. So this makes it even more challenging with digital teaching for this group. Additionally, there's a very important side element for this group, and that's namely that as newcomers to our countries, language courses, language practice, or language cafes organized by civil society may be the first arenas where the refugees get a social network and connected to the local community. So language training is also an important socializing arena that is missed when the language training goes fully digital. So summarized under lockdown, it may be particularly challenging and have negative side effects with turning this element of the integration program fully digital. Moving to the second pillar of the integration program, education and/or employment measures. So earlier studies, including our report, show that subsidized employment and regular education are the two measures that are most likely to increase employment chances. And generally, during normal financial recessions, active employment measures like subsidized employment and work practice are something the government can usually invest in, be a tool for the government to get people employed. However, as you know, the corona situation is different because it doesn't help if the government wants to spend money on active employment measures. The main message is we should not be at work. We should preferably work from home. And the key message is distance, distance, and distance. So this implies that one of the main integration measures, except for in some sectors, may be temporarily inaccessible. However, what about regular education? The employment gap between refugees and the majority population is often presented as a qualification gap, a gap between the formal qualifications that refugees initially have and the competencies Nordic labor markets need. And studies, including ours, find that the investment in the initial years in basic or supplementary formal qualification in the host country significantly affects employment rates. So with these insights, let's summarize and reflect. The bad news and the reality is We are in the midst of challenging times, and it will probably take time to recover our economies. So I have a pessimistic and not very controversial qualified guess, and that is for 2020 and the few next following years, we have to expect lower employment results for newly arrived refugees. And it's also worth highlighting that this can have severe consequences for the individuals. More European countries, including the Nordic countries, have made access to permanent residence permits conditional on self-sufficiency and employment requirements. And this is with a very tough employment market the next following years. The corona crisis may have substantial effect on refugees' opportunities to get a secure legal status with no fault of their own. And lastly, even though it has not been the main topic of my presentation, the long-term effect of the reduced social integration for this group is troubling. However, in these challenging times, let's also look for the silver lining. And first of all, during this pandemic, we have all experienced a digital revolution, and particularly so in the education field. And it is the fact that education measures and language training for refugees and immigrants cost a lot of money. And this digital revolution may produce some new digital solutions that could ensure more efficient use of resources in the future. And I don't want to contradict myself. I do not mean that language training should go full digital. As I mentioned earlier, this is also an important arena for social integration. But this revolution in the education sector concerning digital competencies could also hopefully be exploited for this group in the future. Secondly, in some countries now, in the Nordic countries as well, there is this intense focus on refugees becoming self-sufficient and employed as fast as possible. However, in our new article, my co-authors and I present a thesis that this transcending focus on rapid self-sufficiency actually may hamper long-term and stable labor market integration. So, if there are less jobs for some time now in the nearest future, and active employment measures may not be accessible for some period of time, why not use this unique opportunity to fill the qualification gap and prioritize investment in formal qualification instead of short-term employment? So maybe we have to accept that there will be lower employment rates for this group in the initial years. But if we exploit this opportunity to invest in formal qualifications the initial years, we may counter out the prediction that this group will be disproportionately disadvantaged in the long run. Thank you.
Thank you very much, Vilde. And I have a quick question for you, actually. So one of our audience members, Adil Sadiku, has asked whether to help compensate for some of these problems with language instruction and holding it in person or inside as normal, whether any of the countries have experimented with models such as outdoor language learning. And do you know of that or of other ways that language schools have been able to compensate for these problems?
I haven't done any research on this myself, but I remember Hanne Kavli presented a report from Norway yesterday. I haven't read the whole report, but what I saw from that presentation was, of course, that a lot of the people who have been responsible for this language training have come up with very creative new ways. They have been teaching online from their kitchen at home and making a really big effort. So I think one of the main points there would be to try to collect experiences from this, and maybe there are some elements here you can standardize more and use for the whole group, and then in the future hopefully we can have physical teaching as well, but then it can be combined because a lot of refugees have families, they can't participate physically in all aspects, and then maybe this mixture of digital and physical teaching and language training could be a positive effect of this challenging situation.
Yeah, great, thank you. Great, we're going to introduce now our next research presentation, and that comes from Martin Grander, who's a researcher at Malmö University. So Martin, welcome.
Thank you so much. It's a pleasure to be here and to present some of the ongoing research from Malmö University. I'm a researcher working mostly with urban issues and particularly with housing. And I'm going to present some of the ongoing research that we're doing on crowdedness, and housing inequality, and how that affects the effects of COVID-19. So the working title of this paper is Housing Inequality and COVID-19, how inequalities in housing affects the pandemic and how the pandemic aggravates housing inequality. And as the starting point for this research is, let me see if I can change this slide here. Do I have control over the PowerPoint? Let's see. I'll try again. There we go. Well, the starting point is that all social crises, irrespective of their nature, have a tendency to reinforce the pre-existing inequalities in living conditions. And we have seen this from previous crises during the last 30, 40 years, that it is the poor, the low-income earners, and the vulnerable groups who generally suffer the most from both natural disasters and economic crisis. And this is particularly interesting to discuss in the wake of COVID-19, because it is no exception. We have heard, I think, in the beginning of this crisis, some said that the corona pandemic is we are all equal for this pandemic. We face the same consequences in terms of health and death when it comes to this pandemic. But now, when we look in hindsight, we see that it is not really true. It is the poorest households, immigrants, and people with low social security who are facing the worst consequences of this pandemic. And my research here takes the starting point in the field of housing here. And I would like to say that the COVID crisis is not a housing crisis, but it is a home crisis. Because as we heard Vilde said in her previous excellent presentation here, the keywords for this dealing with this pandemic is distance, distance, and distance. And of course, then where are we to distance if not from the home? So the home has a very particular position in this pandemic, both in the efforts to counteract the severe consequences, but also how we see that these effects have different consequences for different groups. And we know that in the homes we are said that we are going to isolate, we're going to do our home work, we're going to do our home education, and we are seeing that hundreds of thousands of people are working from home, finding new routines, new patterns of meeting and distancing. So the question of home is very interesting to discuss in the wake of the COVID-19 crisis. But this also has consequences when it comes to the financial markets of the housing and the home. As you can see on this slide, the housing prices in Sweden, despite that this is a very severe financial crisis initially in the beginning, we see that the house prices are booming in Sweden the last 12 months. We can see that in the larger cities, we're seeing rises in between 9 and 16% of housing prices in these regions. And this is, of course, a boom which we have not seen with regards to housing in a long time. And that is, of course, interesting to relate to the impacts of the COVID-19, because this shows that people who are having the possibilities, economical possibilities, to invest in larger homes, to invest in standalone housing, and to invest in holiday homes, are doing so. and the economic consequences for these groups are not so severe. But we also see that in the other end of the relation that is connected to segregation and inequalities, the pandemic has different aspects. We are seeing that, for example, the unemployment numbers are still rising and not settling in the areas where overcrowding is the highest, where the amount of immigrants living are the highest, and the amounts of young people are living. So we need to see this COVID-19 pandemic as in terms of relation, and of course then it relates to the segregation of the cities. And we also see that in the wake of the COVID-19, we see that the crowded households are reporting more abuse, more domestic violence, and other social problems, which is then connecting to the idea of inequality in a larger sense. And what we also see that the minority groups in Sweden are at the largest risk here. So this is why we're trying to take this question of the consequences of Corona and COVID-19 in terms of housing inequality, because we have for a long time in many international contexts discussed the housing shortage in the national context, but I think it's more wise to discuss the inequalities in housing and how that affects people in general in terms of life chances and life opportunities, and that has been extraordinarily visible in the wake of the COVID-19 crisis. So if we take Sweden as example and try to understand the causes of the inequalities connected to housing, we could see that in many aspects this is connected to the demise of states financing for housing and the housing affordability. This is numbers from the Swedish context, where we could see that the public rental housing has decreased its share quite dramatically from the 1990s until today. And the public housing in Sweden is a key for providing affordable housing. It's not the same as social housing in many different contexts, which is reserved only for poor households, but it is a universal public housing system which is available for all households. But the main idea is to provide good housing at a reasonable rent. So the idea is to provide good housing, which also could lead to lessen segregation. And we can see that as the state financing for public housing and the state legislation has changed, we also see this demise of affordable public housing in Sweden over time. And that is, of course, affecting people with low income and people, especially immigrants. And this is also connecting to the other policy changes we see, because if we compare with, for example, Norway, in Norway we're trying to help people also with low income to be able to afford or to buy owned housing. In Sweden, we don't have that special efforts to help people into the own sector. So the rental sector plays a very special role in Sweden and also should be seen as an alternative to owned housing with the same attractiveness. So this is why this is especially interesting for the Swedish case. We also could see that the Swedish housing allowance, the state funding for individual household cash benefits, has decreased over time, and we can see here the rates, the number of people, households with children and households without children, who are entitled to the housing allowance from 1992 until up to today. And we also could see that the state expenses for housing allowances have decreased dramatically over these years. It's roughly half the numbers of today compared to 1995. And as the state itself, Boverket, says here, this means that the safety net for financially vulnerable children and families are dismantled in Sweden. And that is, of course, connected much to immigrant families who are in many ways dependent on the housing allowance. And this is also having consequences for crowding, as I will come back to. I was talking about that the Swedish model clings on to an idea that the rented housing is available for all, and that the rented housing is a true alternative to owned housing, meaning that ideally low-income households should be able to live in both rental and owned housing, and vice versa, high-income households should be available to live in both rented and owned housing. And this has been the idea, if you look upon this graph here, which shows the share of households in rented housing per income quintile from 1980s until 2015. And you can see here in the beginning of 1980s, an equal part of the richest and an equal part of the households with lowest income lived in rental housing. And that stayed that way until the 1990s, where we had big tax reforms in Sweden. And what we have seen after that is that the share of the households with lowest income has increased from 30% and is today, or 2015, around 50%. And if you look at today's numbers, it's above 60%, meaning that the rented housing in Sweden becomes what we call social housing by default. Even though we don't have social housing, it is becoming a second-class housing type for people with low income, while almost all people with high income disappeared from the rented sector. As you can see here, only 10% of the people with households with high income lives in rented housing, and they are then striving to reach owned housing, home ownership. And why is that a problem? Well, it is a problem in Sweden because we have this idea of equality in the housing market, which is not dependent on owned housing. But it's also connected to the idea of segregation, the idea of crowdedness, and the idea of housing inequality, which I will come back to. Because if we look upon this map of Malmö, we can see that the share of public housing is very different from all over the city. We have these blue areas here where we have 100% public housing. And that would normally not be a problem if we lean on the idea that all types of households should live in public housing, both the rich and the poor. But as you can see from my previous slides, the rented housing and especially the public housing is increasingly becoming settled by people with very low income. And that, of course, connects to the segregation, because if we look upon the next slide here, we see here that the same areas where public housing is very strong, we also see that the disposable income is very low. So in these areas where we had almost 100% public housing, we also have a share of low-income households, which is up to 93%. I can just slide back and forth a few times here to show how these overlaps. And again, is this a problem? Well, it wouldn't be if the idea of public housing would have worked as it was supposed to. But today we're seeing much more segregation in terms of housing policy outcomes. And if we add another layer of crowdedness to this, we could see that the same areas where we had a high degree of public housing, a very high degree of low-income households, also are very crowded. As here and here, you can see we have crowding, a rate of crowded households around 55%. And to add to this, then we have this COVID-19 cases. And as you can see here, in the areas with lowest income, most public housing, and most crowding, we also have the highest number of cases per inhabitants compared to the other end of housing inequality, where we have the half that number. So this adds up to our idea of housing inequality and how to understand that in a multidimensional way, because we can see that this housing inequality in Sweden, but also in most other international contexts, with regards to access to housing of good quality, is dependent on the resource inequality. We are seeing inequalities that are rising with regards to resource. Sweden is still one of the most equal countries, but we're also one of the countries where the inequalities in resources are going the fastest, increasing the fastest. And we can see also that this housing inequality affects our existential dimensions. It affects the school results, the unemployment numbers, the personal autonomy if you can't leave home when you're a kid, and so on, and also the stigmatization of the areas, which of course then also connects to unemployment and employability. We can also say that this housing inequality affects vital dimensions. So we're talking about the vital inequality here. We can see here that the crowding is connected to the unequal distribution of housing, and that affects in turn the mental health, the physical health, and the life expectancy, which is all very clear in the research. And we can see that also this connects very well to the impacts of COVID-19. And of course, this then connects back to the resource inequality, because if you can't afford the owned housing sector, then you can't make money on your housing, as many people do. If you are affected by the existential ways of inequality, you are more likely not to succeed in school and in employment. And then, of course, connects back to the resource inequality. And of course, then, if you are feeling not good, if you are mentally ill, or if you are physically ill, that of course also reflects on your housing resource inequality. So this is quite a challenge we have when it comes to housing, and this is a Swedish example, but I think it could be connected to most international contexts. And of course, we're seeing that we have possibilities with this as well, but I think the main lesson here is to learn that the COVID-19 is putting a multidimensional understanding of the home, but also it urges us to address the basic conditions of resource inequality. Thank you.
Thank you, Martin. I have a very quick question for you that's come in from an audience member, but also one of our speakers later in the session, Christian Wirtz, who's a vice mayor in Aarhus, Denmark. He asks, is there a policy in Sweden of focusing new non-profit housing, or allmännyttan, in attractive neighborhoods and of mixing housing typologies more?
There are local examples of this, not the least here in Malmö, where I'm working. We have a very interesting example where the public housing company is trying to construct cheaper housing in the most attractive parts, and that has attracted a lot of media debate. Not the least that we have lots of NIMBY, not in my backyard discussion going on here. So it's quite infected and quite recent debates. But I think it shows that there are political ways to actually contribute to a social mix and to lessen segregation.
Thanks very much, Martin. Yeah. I'd like to introduce now our next speaker, and he is a clinical professor at the University of Southern Denmark, and he's going to be speaking to us today out of his expertise and experience in working with in a clinical setting with immigrants. Welcome, Morten.
Thank you very much for the invitation. I think what we've seen is more a process of exclusion than inclusion or integration, and it's probably most of it caused by the language barrier, probably being broadened by COVID-19. Ethnic minorities are disproportionately hit by the COVID-19 epidemic or pandemic. But if you look at all the published papers on COVID-19, a recent review found over 30,000 publicized scientific studies on COVID-19, and only 0.3% address the issue of inequality for ethnic minorities. So it is really a blind spot in research and health in general, normally, and especially during COVID-19. So I'll take the opportunity to sort of dig into sort of the language barrier issues and what's really the issue here. And this is a quote from a patient that really sort of nails it. I would prefer not to die in a language I don't speak. So the basic issue of language barriers is actually anxiety and what you do when you experience a language barrier. I'll address 5 issues on the core values of health in maternal language, what kind of values we are communicating into, how ethnic minorities develop hybrid concepts in the lack of public information or access to it, how intersectionality and syndemics can actually be a way of looking at inequality in this field, and that we need to prepare a lot more in times of peace instead of sort of starting to prepare when we have the challenge ahead of us. Language is actually the tool to become a member of a community. You're acknowledged as a person, you're heard, and you count as an individual through language, and we become meaningful citizens through language. But in real life, language is actually the great divider, and I think COVID-19 has demonstrated that quite clearly. It's also, as Wittgenstein said, a refugee has lost everything except the accent. So it's also sort of an issue that can actually stigmatize you just by having an accent, and it's very often the case that the mere presence of an accent is enough to expose you to inequality. I never talked about feelings in Danish before. A patient that for the first time in her life in Denmark had access to an interpreter. All her thoughts and feelings and expression of feelings she normally dealt with in her maternal language, but in her working conditions, surroundings, she spoke perfect Danish. But actually, she had never talked about feelings because she didn't know how to express them in Danish, because she used to express them in other languages. So very often, even bilingual immigrants and minorities can have benefit from an interpreter. One patient told me, I'm quite strong in my own language, meaning I think most of us can relate to that. If you have worked in a foreign country, that you actually often know what you would have said if you could, but if you can't, you feel sort of impaired and weak, but you know you're strong in your own language. And that sort of dilemma often leads to a lot of mental stress. I can't communicate with my son, this elderly lady said. His Arab is very bad because he learned the Arab language in Denmark, and the patient didn't speak any Danish, so she actually had a very limited way of communication with her son. So many elders are actually caught in sort of an unhealthy language limbo, where they can't talk to anybody, they can't read anything, and they depend entirely on their children, which they can't communicate with. One of the key issues is that you actually learn to be sick as a very young child. You express something, and then you learn from your relatives, your parents, your friends, how to interpret your symptoms and how to react to symptoms. And you are taught how to you're socialized into behaving as a patient and talking about your symptoms in a way that other people can understand. You learn it as a very young child. And that means that some of our illness values and metaphors that we use in talking about our pains, for example, they actually coded only in our maternal and child language, which can sometimes be very simple, but at least we have to acknowledge that it's actually only in the maternal language. It's not coded in the second language that you learn. And that means that we are actually better patients in our own language. So we become more meaningful as patients if we are allowed to speak our maternal language when we talk about feelings and symptoms and things like that. One patient told me, a bit surprising, but actually quite important, that if we were going to tell her something that she had to remember, or if we had to discuss feelings, she would like an interpreter. She also spoke Danish perfectly, but the difficult stuff, the remembering stuff and feelings actually needed an interpreter. So some things are still coded in your maternal language, even though you've stayed in the country for many years. Another issue is that 45% of health professionals' words and how we communicate are actually Greystone words. We don't think they need to be explained, but they actually do. Body mass index, IV, anti-diabetic, hypertension, acute, circulation, fluid balance, risk, tissue, all these concepts that we use a lot when we talk to patients, they actually need some explanation, and many of them actually need a lot of interpretation once you are bilingual. But it's actually 45% of our language as professionals that contain others. If you look at universities with where you have different languages, English is actually enough to create less, leads to less interaction, dialogue. You have fewer questions from the students. You have sort of a stiff, formal, not very nuanced language. There's no humor or anecdotes to illustrate your points. Your personality disappears, ambiguities are not solved, doubts are not raised. There are too many and too wordy, imprecise explanations, and the information content is actually weaker. This is just from Danish to English. Now, experience trying to imagine what happens when it's Danish to Arab or Somali. Bilinguals are afraid of being misunderstood, and they have experience of multiple experience of being misunderstood. They know it's difficult to challenge biases that they're exposed to. They suffer from a long life with misunderstandings, from what I call bilingual anxiety, and they try desperately to collect information from multiple other sources to fill out the missing information that they need, for example, in terms of COVID-19. As Bernard Shaw said, the single biggest problem in communication is the illusion that it has taken place. So we need to have tools and competencies to secure that our communication is actually taking place and it's not just stopping it as an illusion. This is just to give an idea. I think the previous speaker gave you some of the ideas. We're actually talking about a deadly cascade of evidence. Those who have least influence on their work conditions are also most likely those that have low-paid frontline service jobs where they are highly exposed to other infected persons, and they have a short school education. But they are also those that have least influence on their housing conditions. We just saw that. And they are also those who live in the most crowded households. We just saw that. And they have the highest risk of chronic illnesses. And they're less able to protect themselves because they are less able to understand and adapt the public health messages to their own everyday life. And at the same time, they're at higher risk of contracting a more severe infection. We can see that requires hospitalization and leads to a higher risk of death, almost 3 times higher than the background population. So it's actually a cascade of inequalities that are in place here. So people lacking information, they seek information elsewhere. They seek information on social media. We know the quality of that. They look for media in the home country, which are often more disaster prone than the Scandinavian media. And they ask friends and relatives and then try sort of to put together some sort of hybrid information about what's going on. What we saw with the formerly known swine flu, which was renamed to H1N1, because the name actually led to a lot of fake sort of ideas and conspiracy theories about its origin and what was in the vaccine, and a lot of really sort of mistrust to authorities arose from that section. We saw it with the HPV vaccine among ethnic minorities. It was sold as a sex vaccine for girls before they were sexually active, and it was not really a message that's sort of adopted in communities where you're not supposed to have sex before marriage. So they didn't see that vaccine as their vaccine. Core issues in epidemic tool are actually socially coded: contagiousness, carrier states, social contract. Distance is a social coded figure. Family, what's a family? Is it 10 persons or 70 persons? What are my friends? What is physical contact? Births, deaths, marriages are all sort of coded socially and need to be sort of adopted into a Nordic context. And it's too late to communicate when the panic has spread. Frightened people make frightened decisions. People with short school education make short-sighted decisions, and poor people have poor choices in terms of work, isolation, masks, hygiene, etc. Information doesn't spread the same way across university communities. In some communities, it's mouth to mouth. In other communities, it's only spread among sort of equal genders, either among women or men. Some age groups spread information, but they don't cross generations. And sometimes spouses even don't talk to each other, so only one spouse has the information, the other one hasn't got the information. Information has never had the intended effect. I did some research in Africa where we saw that mosquito nets are actually used for fishing because they're very good fishing nets. Condoms are put on broomsticks because that's how they are demonstrated. And people who haven't gone to school think that they work on a broomstick, and it's really smart. And in Denmark, we saw that patients actually felt that the air was contagious. That was actually the message that went through to them. So they over-implemented the idea of isolation by sort of barricading themselves with their children at home and denied the children to go to school. Integration politics actually have clashed with public health in the recent months. Danish is the official language, and it's sort of all sort of bilingual health information has been removed in most cases from public sites. It's not a priority to translate COVID-19 information, was what the Prime Minister said. You should talk to your neighbor, or you can read it in English or German, or you could just pull yourself together and learn some Danish. So sort of integration politics that have changed over the past decade clashed with the public health need for having a public health message for everybody. So who's the winner? Is that simple politics, public health safety, or coronavirus? The coronavirus doesn't care about language issues. It actually likes them. You can't negotiate with the virus, and the virus doesn't care about principles. And actually, the virus loves the misinformation that arises from these language barriers that are not overcome by translating information. So actually, it's been a very, very clear clash between what politicians want and what public health want. And I don't think that discussion is ended yet. So don't bite the hand that feeds you, because there was a lot of shaming and naming of certain ethnic groups, at least in Denmark. And then the next day, you wanted the same ethnic groups to help you sort of spread information that in the first hand wasn't actually translated. And they asked some of the role models in these environments to come and help them. And they said, why should we help you? You shamed us yesterday, and now you want our help. I mean, don't bite the hand that feeds you. It's very often a counterproductive effect you have. So use multiple channels and media types. Use WhatsApp. It's a very fast platform, and you can send very large videos and audio tapes. Use Facebook. Control the information on Facebook. Use cultural organizations, social welfare workers, integration specialists in kindergartens. Find role models before it's too late and before they're shamed. Translate everything. Produce a lot of small videos, sound clips, and pictograms, and distribute them. Explain how information should be used so they help people translate it into everyday lives. Follow up how information is perceived. Adjust messages accordingly, and repeat it. Prepare in times of peace. Build contacts and competencies when it's peaceful. Identify persons that you need with a high impact. Follow and monitor rumors and address them, and inform about fake information, and address specific social issues like water pipe smoking and funeral rituals and stuff like that. have this information ready before you have this situation. It's too late when it's there. So the take-home message is core health values are coded in the maternal language, so you have to start there. We are not communicating into a vacuum. Find out what we are communicating into and how we should do it. Be aware of the hybrid cross-cultural concepts that develop when we lack public health information. Try and look at intersectionality and how syndemic sort of social issues actually sort of reinforce each other into sort of a mix of very strong negative social determinants of health, and prepare in times of peace. It's too late when the pandemic's there. Thank you.
Thanks very much, Morten. There was a comment from one of our audience members, Neela Kagiri, that is agreeing with you about that, especially in some cultures, the way pain is expressed is not necessarily the way it can be understood in the Nordics. And you also mentioned risk as one of these hard to translate concepts and to communicate. Do you have specific advice for how, when public agencies are translating materials and trying to get messages out there, what kinds of processes they should go through to make sure that they're communicating risks in the right way?
I think there are several things they should do. One thing is sort of to investigate what is the information pool that I'm talking into. What is the existing ideas about COVID-19 for that matter, and contagiousness and understanding of how it spreads and who's got sort of the responsibility for it. So obtain some basic anthropological information about what's going on in each sort of the bigger sort of ethnic minorities, and use some of the role models or the authorities that are already there. We used there was some Somali health organizations that are actually sort of quite well known, and they have some authority. So you use those to sort of communicate into the environment, but you can do it alongside with them. Instead of sort of handing over the information, you should do it alongside them. So you also give them sort of an authority from the authorities to talk about these issues. So more collaboration and use the channels that are there already.
Great, thank you so much, Morten.
Welcome.
I'd like to now introduce our next speaker. It's Herbert Brücker, who is professor at the Department of Migration and International Labor Studies, the Institute for Employment Research in Germany. Welcome to you.
Okay, many thanks for the invitation. And yes, I'd like to go through this presentation, but perhaps before I start, a couple of words about our databases. So my institute has an affiliation with the Federal Employment Agency, and that implies that we have access to a couple of registered data, and most of the data I'm going to present are stemming from these administrative sources, but we have also two surveys, panel studies of the migrant population, one for the regular migrant population and one for the refugee population, and we have representative inference from those panel studies, and we have had special surveys in the field during the COVID-19 lockdown. I am only sketching that, so most of the data I'm going to present stems from the administrative sources because that are the most recent data. Can I have the next slide, or can you somehow, yeah, in the next slide? Can I? Okay. Let's start a bit with the development which we have seen in Germany before the outbreak of the COVID-19 pandemic. What you do see here on that slide, that the employment of foreign nationals has increased by a factor of 2.2, and during the last 10 years or so. And that's a big increase, which is largely triggered by immigration from the European Union, about 60% and about 40% from third country nationals. May I have the next slide? As you all are aware, we have had the huge refugee influx, and what you do see here on this slide is a labor market entry. That means that it's a cumulative share of those who have had the first job, and after 5 years after arrival, that stands for the recent refugee cohorts at a share of 65%, 67%, and that is a bit faster than what we have seen in previous refugee episodes, for example, after the war in the former Yugoslavia. May I have the next slide? That translates in slightly lower employment shares. So 5 years after arrival, we stand at employment share of 55%, and that is about 5 percentage points higher than what we have seen in previous refugee migration episodes. For those refugee arrivals who have arrived in 2015, this data is from the end of 2019, we stood at about 45% by the end of the year. So that is the situation before we have had the outbreak of the COVID-19 pandemic. May I have the next slide? Yeah, it is important for the understanding the crisis to have a look at the employment structure before the outbreak of the crisis. What we first see, there is a huge difference in the employment structure, that individuals in Germany, about 50% of those perform tasks in the labor market which you can delegate into the home office, but only 28% of the foreign workforce and 19% of the refugee workforce. On the other hand, the foreigners and the refugees perform slightly more system-relevant tasks. And if you look at the task structure in some further detail, the employment structure is dominated by manual tasks, in particular manual non-routine tasks. That is, for example, service tasks in hotels and restaurants and so forth. In principle, that is an employment structure which is usually not affected by economic crisis. For example, in the financial crisis, the manual routine, but in particular the manual non-routine tasks in the labor market have not been affected by employment decline. If we look at the skill content, we see a concentration both in the unskilled segment of the labor market as well as in the skilled and the medium segment of the labor market. And what might be worthwhile to note that also the refugee population has a relatively high share of skilled workers in the labor market, not the entire workforce there is unskilled. May I have the next task? Slide and slide. Yeah, that shows the evolution over time with respect to activities which you can carry out in the home office. And what you do see there is that for the foreign population, we have seen a high employment growth in activities which you cannot perform in the home office, while for the German population, the opposite is true. May I have the next slide? Yes, and in the system-relevant occupations, we do see a higher growth in this kind of occupations among the foreign workforce, while we do not see any differences for the German workforce. Okay, the next slide, please. What is also very important for understanding later the crisis is the type of contracts we observe that is particularly relevant for the refugee population. We have only 22% of the workforce has permanent contracts, and the other types of contracts are dominated either by internships and vocational training or other fixed-term contracts, and also temporary agency work plays a substantial role. And that makes, of course, this type of employees extremely vulnerable in an economic crisis. Have the next slide. Okay, next slide, please. Let's have a look now what have happened when the crisis unfolded. And we start with employment, and there the picture looks not that bad. So we do see that the employment in August relative to February, that is the last month before the crisis unfolded, we do see a slight increase in all types of foreign employment. Also the refugee population, the asylum seeker population sees a slight employment growth. We see a slight decline in employment for the German population, and a slight decline in total employment. I come later back to explain why this happens. May I have the next slide? If we look at the evolution over time, and now it gets a bit more interesting, perhaps you have a look at the dark blue line. We do see in April, May, and in June an employment decline of the employees of the asylum seeker population. And then in July and in August, when the lockdown was was more or less suspended, then we do see that employment is back on the growth path. But relative to the previous year, where we have seen a substantial increase in employment, which is the result of the favorable labor market integration of this population of about 13 percentage points, we see only an employment growth of 1 percentage point. So the interpretation is largely that the labor market integration more or less have come to a halt, but we have to see what is going to happen by the end of the year. And not much happened if we look at total employment, if we look at the evolution over time. Okay, may I have the next slide? We have a different picture if you look at the unemployment rates. So the asylum seeker countries, the citizens from there, are particularly affected by an increase in unemployment, and also the foreign citizens are disproportionately affected, while we see only moderate, mild effects on the German population, and as a consequence of that, on the total workforce. This looks in the first place puzzling, but that is basically the result that we see into the labor market a large influx of people which come from integration measures and language programs, integration programs, and so forth. And those programs expired in the course of the crisis. And that translated one-to-one into unemployment, because the labor market was, or the companies were not anymore able to hire people during the crisis. So we do see a slight, only a very slight employment increase, but a huge increase in unemployment, which can be largely traced back to a lower participation in integration and labor market programs. Next slide, please. Yeah, here we do see the evolution over time, and we see a huge increase for the asylum seeker population after the lockdown, which started by the end of March. And there we see a substantial increase by about 6 percentage points in the unemployment rate, and then only moderate decline when the lockdown ends. And again, this can be largely traced back to the end of the integration measures. Next slide, please. Yes, how can we explain the developments? The relatively favorable employment development has something to do also with ongoing immigration, in particular from the EU member states, but less so from the refugee population, which translates then into higher employment. and on the other hand, declining supply and participation in integration labor market programs triggered the increase in unemployment rates. We also see a very low labor market turnover. Yeah, that's nothing novel, that we have seen also in other economic crises, and that has the implication that hiring declines substantially, and that is of course very bad for the refugee population, which is not yet very well integrated into the labor market. And on top of that, the pandemic affects via two channels the labor market prospects of migrants and refugees adversely. First, via the precarious employment contracts and temporary agency works, and secondly, via the structure of employment. I do not focus anymore on the precarious employment contracts, and we have seen that before, but perhaps have a look at the structure of employment and how different types of employment are affected by the crisis. May I have the next slide? Yes, what we do see is that in particular manual tasks in the labor market, manual non-routine tasks and manual routine tasks are severely affected, and that holds true in particular for the refugee population, and also interactive non-routine tasks are also particularly affected, while cognitive tasks and analytical cognitive tasks are not very much affected. And that is very much related to the lockdown. The manual activities are extremely affected by the lockdown, while the cognitive activities you can delegate largely to the home office and did not suffer that much from a decline in employment or an increase in the unemployment rate. May I have the next slide? This is by a breakdown by skill requirements, and what we do see that most adversely affected are the so-called helper categories, that are semi-skilled or unskilled tasks in the labor market, and the other ones, skilled labor, specialists and experts, are more or less at the same level affected, but we do see a concentration of the adverse effects in the less skilled segment of the labor market, where we do find a very high concentration of refugees, but also of other migrants. May I have the next slide? Okay, let's sum up. Migrants and refugees are affected by higher unemployment, but employment remains rather stable or even grows slightly. Refugees suffer in particularly from a declined supply of integration and labor market programs, and that is perhaps the most important policy conclusion. We have something to do to reactivate those programs, and many of those programs do not work in a digital way, or not that easily, but we have to invest in that. And precarious employment contracts and high shares of temporary agency work put jobs of refugees and migrants at risk. And refugees and migrants suffer from an adverse shock, since manual jobs are disproportionately affected by the lockdown. And what is perhaps important, if we make up our mind about the future, the evolution since June 2020 hints for a slight recovery, but we have now the second wave of the COVID-19 pandemic, and that will certainly hurt migrants and refugees again. That depends a bit, of course, how we handle the next lockdown and which sectors of the economy are affected. My personal assumption is in the medium term, when we have the recovery from the COVID-19 pandemic, more or less a similar employment structure will emerge with similar specialization patterns, and that favors the labor market integration of immigrants. important thing for understanding the relatively favorable labor market integration, both of refugees and migrants, during the upswing in the business cycle during the last 10 years, is that manual jobs, in particular non-routine manual jobs, have seen an employment growth in Germany which is twice as high as the average, and we do see the same for the academic jobs. And the jobs with middle qualifications have grown below the average. So we see in Germany a polarization in the labor market, and migrants, because we see among the migrant population both a higher share of individuals with academic qualifications as well as without vocational training, is benefiting from this polarization trend. So that in the medium term, when we recover from the crisis, I'm still optimistic. Okay, thank you.
Thank you very much. And go ahead and stay on, because we'll introduce our other panel members back in for the panel discussion. So welcome again to Wilde Hannes, Martin Grander, and Morten Soderman. You know, I'm struck hearing all of you speak, and of course you have each different fields. You're speaking to different aspects that relate to the position of immigrants and refugees in the Nordic societies and in European societies. But I keep coming back to this aspect of differential effects of crises, and that you've all spoken to some aspect, whether it has to do with network and learning language, the ability to work from home and position in the labor market, whether it has to do with housing possibilities or health, or a number of other different issues. So I'd like to kind of put a similar question out there to each of you, understanding that you're working with very different fields. What's one particular challenge that you think is intensified because of this differential effect of the crisis, particularly that you see in your work? And do you see a way of addressing it? Do you see a constructive way to address it? I'll take fingers or hands to indicate people who. Morten, go ahead.
To me, I think some of the ambiguity and anxiety that is sort of a condition of being bilingual and in exile somehow is reinforced to an extent that is nearly impossible to adjust it when it's there. So I think in preparation for the next pandemic, that's one of the things that we have to address more aggressively, to reduce this sort of anxiety that actually produces more conspiracy, more misinformation, and need for extra information, and maybe also information delivered in a different way than we are used to.
Thanks. Herbert Brügger.
Yes. I found your talk, Morten, extremely interesting, and if I may add up some observations from our labor market research, which I think is in principle supporting that. We are observing two things. One is certainly German language proficiency is helpful in the labor market, so that's not a surprise. And therefore, of course, we are not happy seeing that many programs have been cancelled now in the course of the crisis. But what is perhaps more interesting, what we do see that ethnic networks are one of the main channels to find jobs in the labor market. And many of those jobs we are talking about are in companies which belong to other migrants. And there you have perhaps no language problems because they do not speak German, but they speak something else, but they can communicate. And using these resources of those networks is economically, of course, efficient. It can be a trap in the labor market, but we do observe in our research that you have a higher entry wage and a higher employment stability if you find a job via a co-ethnic network. And if I don't know whether I have correctly understood your talk, but I think working together with these kind of networks and communicate with them is the trigger for public health issues. And the same, I think, is true also for labor market policies. So if I go to my employer, the Federal Employment Agency, I always argue, try to work much more with companies which are owned by migrants rather than focusing only on the German companies. And therefore, those networks, I think we have to make those networks permeable, yeah, that individuals still try to learn German, yeah, so don't misunderstand me. But using those networks as a resource might be helpful before crisis, but also in the crisis.
Martin, go ahead.
I would like to address the school question. I think in Sweden we see that the school segregation is so important in order to combat the consequences of segregation in the next generation, because we see that we were touching upon the idea of social mix during my talk here, and we can say that our generation we are lost. There's no hope for us when it comes to integration and reducing segregation. This idea of neighboring effects and so on is very hard to accomplish in our generation. But the research is so clear that the idea of and the practice of mixed schools really means something for all children attending mixed schools. For immigrant children, they have much more better possibilities to get an employment and a good education if they are attending a mixed school in lower ages. So I think while at peace, we need to think about how to reduce the school segregation and how to combine efforts in order to find a good social mix at young ages.
Thank you. Vilde?
Yeah, from a different perspective. I think one thing that is important is that integration programs and integration work is usually, and in many European societies, is the responsibility of the municipality, even though there are national laws regulating this. And in this crisis, I think it's very important that how the municipalities react to this. Some may have grand resources to try to make things digital and have these this effect to find new solutions quickly. But there's a lot of small municipalities and local governments throughout these countries that have to try to find these solutions themselves. So I think now that we're entering what may be the second wave or is the second wave, that maybe for the central government can try to organize, like not force, but help local communities to find the solutions that they have tried in the first wave. When they're in Oslo, during this presentation, Oslo is locking down a lot of things right now, and we have some evaluations, as has been presented in the seminar, of what happened the first lockdown. So can we build on that knowledge and maybe find some of the local communities that have found solutions and try to bring that up to a larger scale? Because one fact is that we cannot continue as normal now, and then we have to try to find the good solutions as they go. And then I think the cooperation between the national government and the local governments is important. So not every local caseworker and every local community have to find innovative new digital solutions themselves and try to help each other in that way.
Thank you, all of you. I'm just going to ask you one more question for the end of this small panel here. And so I'd like fairly brief answers to the question of whether the pandemic and the lockdowns here have brought new agenda items to your field of research. What is it that you're going to research now that you maybe didn't before? Is there a change to this, or is it fundamentally that you're going to keep researching the same questions? They're still relevant. Morten? Oh, we can't hear you, Morten.
I was quite surprised to see what happened when we had an outbreak in a Somali community in Denmark. First of all, sort of the public reaction was one thing, but the reaction within the community was actually quite the opposite, that they very quickly intervened, sort of themselves almost, and stopped the outbreak. And I think the same was the case in Norway, in Oslo, that they actually reacted extremely quickly and much faster than the authorities could actually sort of have done it. So there's some potential there that we need to look further into. And the other thing is that we started contacting patients by telephone and video conferences instead of them coming to the hospital. And they actually saw that as an act of kindness from the Danish community. That you actually want to talk to us. But now, can I ask you? And they ask all sorts of questions that were sort of unrelated to health or anything. But actually, now that you're so kind, can I ask you about how do I hoard? I mean, every Danish citizen is hoarding. How do I hoard what I need? So sort of odd questions, but it was seen as an act of kindness, just contacting people. That's also something we will pursue. Thank you.
Others that have new aspects they're going to research now. Martin, did you have a point?
I think we will continue with the same kind of research, but I think the public interest and the policy measures with regards to what happens in the home will be larger, and how the home affects different people in different ways. So I think there will be much more interest for research. I hope so, at least, and also the policy measures regarding home and what happens in home when we are supposed to be at home much more, and we have different preconditions for being at home. So I think we will be more interested in the questions.
Thanks. And how about you had also a point?
Yeah, there are a lot of things there. Given that we have this service in the field, we do antibody tests, so we try to find out which groups in the population are more or less affected, to get an idea about that. And that has what interests me are the long-lasting consequences, both from health issues as well as if people disappear from the labor market. We know that larger unemployment spells have long-lasting consequences. And then we have all the other issues on the table. What is happening at home, what's just mentioned, because we know short-time home office, work in the home office, we know something about the family relations, and that has, of course, then again consequences for the labor market. And then finally, what I have raised the topic today, we learn to better understand structures in the labor market, employment structures, because jobs which we have assumed before, which are not vulnerable in economic crisis, that are most of the service jobs, are now heavily affected, while, for example, construction jobs, which are usually extremely affected in economic crisis, are not. So that also change our understanding of some issues in the labor market for the future, if it is not a single event. We do not know yet. I think we will go basically back to normal after the crisis. We do not know when, but that's my hypothesis, but it might not be true. We will have a close look at that.
Thanks. And Vilde, Hannes, you get the last word here.
Well, of course, this new digital solutions that the municipalities use will be something that will be very interesting to look at and further research. But I also want to, I only briefly mentioned this in my presentation, but that is the effect this crisis will have on refugees and immigrants' access to permanent residence and citizenship. Because almost all countries now have, and I think if I'm correctly, Sweden is introducing the same things as Norway and Denmark have had for years, or some years. They have language requirements for obtaining permanent residence and citizenship. They have self-sufficiency requirements. And these are often introduced with the justification that they should incentivize the refugees to integrate into society. That is the politicians' arguments for these these new requirements. And how are they going to be evaluated now that if they don't get language courses, and if they don't, the employment market is at a stop, then it's not their fault that they don't get, even though they are motivated to get integrated into the labor market, they may not have the chance to do it. So it's going to be very interesting, first of all, to see how this affects these rates, that they will take some time before we can actually measure that. But also if the countries adjust their policies a little bit to acknowledge that these are unprecedented times, and then maybe people won't fulfill these requirements to the same degree. So that's something I'm very interested in looking further to in the future research.
Thank you, and thank you all for presenting, for being here with us. And so with that, I'll thank all our researchers who presented today, and then we're going to take a break. It's shorter than planned, but we'll come back in 10 minutes and start again at 14:12. And so you're welcome to stay on the webinar, and then we'll just start back up in 10 minutes. Thank you.
Okay, was a pleasure. Bye-bye.
Bye. Hello to everyone and welcome to you again after our break, and welcome back for the second part of our plenary session today in the Nordic Council of Ministers Conference. I want to mention to those of you who've joined us since the beginning that you can download a copy of the full program for today in the handout section of the interface you can see here. Again, you can also ask written questions to the question interface throughout the rest of the program. So with that, I'd like to introduce our next speakers. So for the second part of the program here, we're privileged to have 3 leaders from 3 Nordic cities with us. And they are leaders from Helsinki, from Aarhus, and from Oslo. And so I can introduce here before the first speaker begins, we have Sanna Vesikansa, who is Deputy Mayor and in charge of social services and healthcare from Helsinki. And then we have Christian Wurtz, who is the Deputy Mayor with responsibility for social services and employment in Aarhus, Denmark, where I live. And we also have Rina Marianne Hensen, who is Vice Mayor of Department and in charge of the Department of Employment, Integration and Social Services in Oslo. So a warm welcome to all of you. And then we'll welcome Rina and Christian back later when it's their turn to speak. So for right now, I will introduce Sanna Vesikansa, and you have about 10 minutes to speak. So welcome and go ahead, Sanna.
Thank you, and good afternoon also from Helsinki, and good to meet you all, and also colleagues from other cities, political decision makers. Good to have a conversation after this with you. So I will just briefly tell what is the situation and some learnings from Helsinki. And I guess you are the one who is taking the slides, or can I lead it? Let me know. Hopefully you can take the next slide.
Please press the presentation, and then you can use your own.
Okay, I'll try. No?
You should be able to, if you click on it and then use your arrows back and forth. Yes.
Something happened at least. Thanks. So just to give you an overview of Helsinki and what is the situation in Helsinki, here is some numbers of the population with foreign background, both in Helsinki and in Finland. Helsinki's population is 650,000 inhabitants, and around 10% have been born elsewhere or are foreign nationals who live in Helsinki, are residents. So the share is, I know, a bit different than in many other Nordic cities, but altogether in Finland, in any way, one of the largest shares since immigration to Finland started a bit later than to many other Nordic countries. And the largest language groups are Russian, Estonian, Somali, and Arabic. But of course, we also have various others as well. Let's see if I can, yes. Well, the curve with the coronavirus in Helsinki looks probably very much like yours. We are definitely having a second wave, if we can call it now. Of course, the situation in Finland is one of the best in Europe, but both in spring and also now, Helsinki has been one of the largest or hardest hits areas or cities in Finland. So especially in the springtime, our percentage of the nationwide infections was very high. Now it's more spread in the whole country. But in any case, we know that this is also has something to do with the urban areas, people living together and also being close by each other. Also, when you look at the Helsinki in different parts, here are the infections. This is now from October, but very similar has been all these months. So it is more concentrated in certain city parts, especially in the eastern Helsinki, where we have also more residents with a foreign background. And of course, we also have had those infections in among the older inhabitants, especially in the springtime, as I'm sure all we share the very similar problematic. Now we know much more, of course, about the infections and also the risk groups. Here's just listed some of the city actions where what we have done, especially in the information and trying to get the information to our residents, also with different language skills. So always we have used a lot of interpreters and also different languages, but especially with the COVID of everyone being in a very strange and new situation, we of course try to focus a lot so that we have information in very many different languages. Maybe the problem at the moment is now that in the springtime the decision making was very national, so we had the same rules in the whole country. Now it's more in different areas, a bit different situation, and also the actions, for instance, the restrictions have been a bit different, and then trying to keep the information as simple and as easily understandable to everyone. There we definitely have challenges, but anyway, trying to focus on that. I will just say some things that I feel that are also very important, and I know that has been also used in many other Nordic cities as well. For instance, in tracing, where we have been trying to also trace the infections very well, and we're still keeping it up. For instance, in Helsinki, more than 50% of the infections can be traced. And we have put a lot of effort and a lot of also staff to it. In Finland, the cities are also running the healthcare, so maybe for you good to know that we have the responsibility of all the healthcare as well. There we also had multilingual tracing teams, for instance, in Somali language, other languages, so that when they contact people, then also if they are quarantined or told to go to the test or any other worries, that we will have the languages available, and many other actions that are just listed here. There was a spike in the infections, especially among Somali speakers in Helsinki, and there we also in the springtime there was a lot of Somali language targeted information, and also very important other projects started. For instance, the Somali community themselves, NGO, started a TV show. They got also public funding for it, that they will reach from Somali TV, and very important things. They were not done by the city, but anyway, we definitely embrace also the actions. And also the previous speaker was saying that it can be also something that has a lot of impact, and that's important. At the moment, they are somewhat overrepresented with a foreign background, but not the same situation as in the springtime. Then something about, since we're talking about also integration, I think what is very important, also thinking of long-term effects of the COVID, is also the hit in the employment, and Helsinki, like I'm sure many other capitals, is very service dependent city, and also tourism has been hard hit. So especially in there, we can also see that the unemployment among both foreign and also residents with a foreign background, the situation is very difficult, and especially among younger people. We try to find actions from the city to this problematic as well. Here are some learnings, and first of all, I think we need to still learn much more, both from the coronavirus. What are the reasons that it has effects among certain population more? I think we still don't know all the reasons, although we can of course now say that there are probably socioeconomic and cultural and many other reasons, people being more in contact with each other among families, etc. But I think one big learning is that we need to understand that that even if we take, for instance, the mother tongue as one indicator, it cannot explain all. That also immigrant background residents, they are very different ones. There is not one youth, there is not one resident with a certain language background. So we need to understand this dynamic much more, and we definitely should not jump into conclusions too fast. And there I would really, I would say it's really important also for the cities to work a lot with the academia and with the data and really understand what is it all about. Definitely we had challenges among school children with the distance learning and digital learning, families not having enough capabilities to support the children because the change was so quick and it lasted for a long time. I think that one learning from that in our city is that definitely the closing of schools will be the last that we do that. First of all, we try to have restrictions and cut down the contacts among older people and especially the working age. We can suffer much less with meeting with our friends, but with school children, with the learning and their friendship and their development, it's really important to try to keep that, not to go to the same situation. In case we need to do some distance learning, we try to do it in shifts and things like that. Then community dialogue is really essential, and the way we do it is essential that we do nothing. For instance, with I think one keyword to remember from other human rights activists, for instance, disabled persons, is that nothing about us without us, and I think in this case it's as important, and to really understand how we can use this dialogue to understand the reasons and to make also our actions to work more to the real cause of really trying to cut the infections. And there we need to learn new things like counseling and outreach, really in the grassroots, and to do this very openly with open dialogue to build trust to the city and its actions. There is, I think, very important things to do. The last thing I will say is that I think also we need to think about the long-term effects to the cities, where employment is also really important. For instance, for Helsinki, many of our people who work in Helsinki, they come from Tallinn and they actually live in two combined cities, and I think this has many long-term effects and probably also to integration long-term. So I think we should really start working on that and focus on that as well, that we will be an open city also in the future. Thank you.
Thank you very much, Sanna. Now I'm going to introduce the next speaker, Christian Wurtz. Christian is the Deputy Mayor and in charge of Social Services and Employment in Aarhus, Denmark. Welcome, Christian.
Thank you very much, and thank you for the opportunity to take part. Actually, the last place I went outside Denmark before the borders closed was to Helsinki, visiting Miss Sanna and studying the Finnish approach to homelessness. And thank you very much for giving us this opportunity to share approaches, even though we can't visit each other. I'm from Aarhus. Aarhus is the second city of Denmark with a population about 350,000 people. We're experiencing massive growth. 50,000 more people have moved to Aarhus over the last 10 years, of course, putting a lot of pressure on some of our important social structures. For example, the job market, the housing market. And I'll dig a bit into that and how it's perhaps been changed as well by the coronavirus. I will not, though, however, have a very short-term focus. I guess I'll try to broaden the perspective a bit out and have a look at what can we do on a more long-term perspective in terms of fighting the problems that has perhaps been accentuated by coronavirus. Now, perhaps taking up the point from Martin Grander before, this is a map of Aarhus showing the social, economic, and also health inequality that we experience in Aarhus. The darker the color on this map, the deeper the social, economic, and health issues or problems of the people living in the neighborhoods. It's the districts are church parishes. If that's, I hope that makes sense as a type of map to you. The interesting point is that although Aarhus is a very, in international terms, perhaps very equal city, we are experiencing stronger and stronger social segregation on the housing market, which translates into, well, what do we call it? You also see that in terms of segregation in school districts, and then in opportunities for people. I'll return to that later, but this means that a very important part of what we do is trying to bridge the division in terms of opportunities given to people in Aarhus, and we're trying to fight the social inequalities that we face, and inequalities that are especially haunting people with non-Western background. If we focus on unemployment, we can see that we have relatively high numbers of employment. I don't know what happened to my slideshow here. I hope that you see a plot of non-Western citizens who received public benefits in 2020. You can see that we have a disproportionately high level of unemployment among non-Western citizens. It increased heavily in spring, but since late summer, we have moved back in the right direction, and actually improving at the same rate that we see in general in Aarhus. Employment is improving. However, of course, the unemployment rates among non-Western citizens are still very high and much higher than it should be. And there are also very serious gender inequalities, meaning that women face higher unemployment than men. An important long-term strategy to battle these problems is, of course, education. And we've actually seen over the last 10 years that more and more young people with non-Western backgrounds get into education, which especially counts for the women. We're also trying to fight the inequalities in the housing market, and the very important link between your position in the housing market and your opportunities in a broader sense by making quite dramatic changes to the housing market. When we have plans to tear down about 1,000 non-profit housing units in vulnerable parts of the city, building 1,000 new in stronger municipalities. And we have a policy and a finance policy that every 1 in 4 new housing units should be non-profit housing units. And in that sense, we're trying to sort of build away the inequality in the housing markets and trying to make stronger school districts, more equal school districts, more equal neighborhoods all over the city. In the shorter term, we're investing heavily in employment and in the municipal initiatives to improve employment. Right now, we're focusing on what we call in Danish smart jobs. It perhaps doesn't translate very well into English, but small jobs. Instead of focusing solely on full-time jobs, we're focusing on the possibilities of giving people well, a couple of hours a week, a job a day a week, what can be seen as a stepping stone into a full-time job on the regular job market. We have a focus on the so-called integration basic education, the IGU, which is a combination of paid internship and education focused on young refugees that actually works quite well. We have started a new program called Staircase to Staircase, which is a holistic and relational job program combining social service, people with social services background, healthcare background, education background to try to improve the employment rates of families and try to have a holistic approach on what is actually keeping a family in unemployment. And then we have a strong focus on the many industries that are actually doing well, just like in Germany. The construction industry in Aarhus is doing very well. The logistics industry is doing well. Social services and health services are doing very well, and important parts of the retail industry is doing well. So there are actually a lot of jobs out there. And despite coronavirus and despite all the changes to the way we live, we find that with heavy investments in our possibility as a municipality to connect the industries, the corporations to the unemployed, we actually have a possibility of lowering the number of people in Aarhus in unemployment, and especially of non-Western people in Aarhus in unemployment. I think that would be my my introduction.
Thank you, Christian. And now I'll introduce our third speaker in this section, and it's Rina Marianne Hensen, who is Vice Mayor of the Department of Employment, Integration and Social Services in Oslo, Norway. And thank you, Rina. Go ahead.
Thank you very much. It's good to see you, and virtual get-togethers are new normal, both within a city and also in meeting you abroad, but it's good to see you. There's little doubt that the COVID-19 has affected us in ways that we would never have foreseen. Our lives, our cities have been turned upside down. And in addition, this pandemic has given us new challenges in the way we work. As was mentioned in the previous section, the municipality of Oslo has today introduced additional and tougher measures to stop the spread of COVID-19. We're in the second wave of the pandemic. The new measures that we introduced just 1.5 hours ago include a prohibition of all indoor events, a prohibition even including religious ceremonies except for funerals. So we're imposing very strict new regulations, and we know from the first wave of the lockdown that this hit hard. It hit hardest among groups that already were exposed in different ways, both regarding language, living conditions, and also other social relations. In Oslo, about 1/3 of our population have immigrant background. And during the pandemic, we've seen the importance of working through our established networks in regard to this part of the population. When you do not meet face to face, the established knowledge and routines that we had from before were vital. As the infection rates now rise again, we need to communicate these new stricter measures that we have imposed. I think this is also what my colleague from Helsinki was addressing. The concerns that the population as such, but can be particularly difficult to immigrants who come to Norway to work. We have a large part that our immigrant population that live here, but we also have, as in Helsinki, a huge number of people coming here to work, but not necessarily living here permanently. Yesterday, our national government announced stricter regulations, stricter test and quarantine rules, and this can make it extra challenging for immigrants as it makes integration challenging in the shorter term. I think the title of today's seminar invites me to dwell a bit on what sustainable integration really means. Sustainability is a goal for our global environment, as well as our cities, our security, and even for our welfare states. To the EU and Norway as well, sustainable integration is the governing idea of integration that we've been working on for several years, calling from moving away from the old remedies to processes that are politically acceptable across generations. It's a process, I think, as well as an ethos and a state of mind. I think that we can agree that sustainable integration is a common goal of the integration policies throughout the Nordic region. And in the beginning of the COVID-19 pandemic, the infection rates also here in Oslo increased rapidly among the immigrant groups. First, of course, also here, we had the ski tourists in Oslo who had returned from their holiday in the Alps. But then it spread rapidly among many of our immigrant population. It's not a surprise though, given that many of the immigrants here in Oslo have service jobs, and therefore they expose themselves to more infection, both working in the taxi companies, but also in healthcare services and the care for the elderly. Not many of them could work from home. In addition, many of them lived in cramped conditions, not being able to hold the distance, the physical distance that we required. So infection control rules are challenging, and implementation of quarantine and isolation was also difficult. So consequently, more immigrants have been infected also here in Oslo. However, these are not the sole reasons, and I think this is important for us also to reflect upon, that the picture is quite complex. One of the issues that makes this a bit more complex is the issue of trust. I believe that trust is vital to a well-functioning of a civil society. And in this regard, I'm thinking of trust in a broad sense, trust in other people, as well as trust in the authorities. Thankfully, Norwegian society is characterized by a high degree of trust, as I think are all the Nordic countries. And this concerns both the trust between the citizens among them and also towards the authorities. It also presupposes that we as leaders and politicians have confidence and trust in our citizens. The great level of trust might be one of the reasons why we here in Norway have had fewer protests against the corona measures, and I also believe that this is a common Nordic experience. Though there might be indications and assumptions, at least here we don't have any clear proof that the trust in the authorities' measures and in the trust in the authorities' recommendations is lower among the immigrant population. We know from research here that what we know is that immigrants have lower trusts in each other. So we assume that cultural conditions among these immigrants might constitute a barrier for adherence to the rules. So what we can see is maybe that cultural rules prevail in infection control. Participating in huge events where too many people gather might become more important than adhering to the infection control regime. This might not be an absence of trust, but we don't know for sure. So I'm thinking it's quite interesting to dive into this more thoroughly. Anyway, whether it is that the information does not come out clear enough, or that is not understood at all, as a result, language and form of communication is what we have experienced is vital in the pandemic. People with limited networks even become more isolated than the population as such. So what are the challenges here in Oslo in the time ahead of us? Of course, today is very dramatic here in Oslo, but I think that the short answer to what the challenges are is also a difficult one. That we need to build and maintain trust amongst those who do not have it before. We need a constant focus on compliance with the rules. This applies to the immigrants as well as the rest of the population, and this is important for me to underline. Further, we must have in mind that the immigrants by no means constitute a homogeneous group. Different subsections, immigrants, act and respond differently. So we can't refer to them, for instance, as a group lacking trust. Moreover, we need to cooperate even more. In this regard, we in the city of Oslo have worked systematically. We've arranged dialogue meetings between politicians and organizations on different levels. As a result, I think we have received valuable information and input on going forward. I think, at least I believe that both parties have expressed great benefits from these meetings, both in being heard by the government and also for us to actually get the real input from the grassroots. It's also been greatly appreciated. We have employed ordinary information measures to the broad public, as well as targeted procedures to reach certain groups. For instance, we had specially adapted measures in some of the city districts. In one of the districts, we had the ambassador project, where people within the Somali population spread the information to this particular group. The ambassadors were Somalis who defined the message and also determined the communication platform. And we experienced that far more people read and listened to the information given to them than the information from the municipality's official communication. Some of you might have heard about this in the session on Tuesday. During Ramadan this spring, we also had close contact with the Islamic associations to ensure good conduct of the celebration and that the celebration was in line with the infection rules. These are just a few of the measures that we have established, but what is important is that they are very targeted. You cannot make a general approach to the immigrants because they're not one group. To conclude, I'd like to say that my core message is trust is really important, and we really need to even build more trust in a time of crisis. And to build trust, we, the leaders, must also listen to our inhabitants. And lastly, we must also, to some extent, maybe as a city, be willing to give up power and say that you are doing this job better than us. And if we succeed in this, I think that maybe we can maintain our goal of more sustainable integration. And this time of COVID-19 is really putting that sustainability to a test. Thank you.
Thanks very much, Rina. Right now, I'd like to welcome both Sanna and Christian back for our panel with the three of you. We don't have a lot of time, but I really appreciated hearing your perspectives from your cities. You echoed some of the same themes that we've been talking about this week about potential differential effects of the crisis, ways of communicating with immigrant communities, and so forth. And now I'd just like to ask each of you, because it was discussed yesterday in our session, there were some differences of experiences about whether the crisis has actually been a game changer in terms of how different organizations are working with immigrant communities and need to work to help encourage integration in a constructive way. So I want to ask you, do you think that the crisis has in some way been a game changer for how for aspects of how your cities are working with immigrant communities and integration? Christian?
I think yes and no. Some of the criticism delivered by Morten Sodemann earlier today is directed at Aarhus. I don't know if everyone knows that, but we had quite a strong debate on how to tackle the problem with corona disease spreading amongst the Muslim community. And I think there is a very important problem with this coining immigrant communities, because even if your parents are from Somalia or Palestine, you don't necessarily see yourself as Palestinian or Somali. You probably see yourself as from Aarhus, and very large proportion of these people have been here for decades and decades, and perhaps for generations. So you don't necessarily reach an Arab community by addressing mosques or other sorts of organizations trying to represent these communities. So yes and no. I think we are learning, and we're on a steep learning curve in terms of improving our contact with some of the communities. But I think it's at the same time it's very important to actually use and to be able to use some of the standard contact points like schools and stuff like that. A lot of especially Somali women don't feel represented by the often male representatives of the so-called Somali communities.
Thank you. And Rina, you raised your hand as well.
I think what we've seen as a city is that we have realized how dependent we are on the civil society. That we actually need to also we need to make sure that the information is correct and that we agree on what the information is given. But then we also have to trust the civil society and their organization that they do the job. And when you give, at least what our experience is, when you have given people this trust, they will stand up and do that. Being willing to maybe give up a bit of the power you have as local authority and the or the informal power you have in the one controlling the message. But it's extremely difficult to actually trust that someone is going to deliver the message in a correct way without going in and controlling it and putting on our own interpreters and so on. But I think we're working. Yeah, I think it's a mental thing. So maybe not a game changer, but a more conscious about this. I don't know. Yeah.
And Sen?
Yes, I think very similar ways as the colleague said. I think we have learned a lot, and I think we still have a lot to learn. I also have heard from, for instance, younger immigrant background, very educated persons there saying that, you know, don't talk about us like that. That there has been a lot of stereotype, you know, big families and this and that, mosque and so on, and they don't recognize themselves from that. And I think this is definitely one issue that we need to learn how we talk about and where to target to really make it work. Because if we do it too wide, it doesn't. It maybe has a negative effect. And that's probably not the reason when we want to really make it change in infections or any other unemployment or in any other. So I think there is definitely a lot to learn. I was hearing the Oslo example very happily, that learning how to work with the civil societies on a wide range, on different levels. I think that's one thing to take home definitely from this discussion. And I think from the whole crisis, our city is trying to document what we are doing on a very large scale, and I think that is something we all should do. Maybe we don't see everything at the moment so clearly, but maybe in next May things look clearer again, and we need to remember all those.
So we're obviously still in the crisis, right? We just heard about Oslo's new measures, and there are similar movements happening many places these days. But looking forward, we've talked a lot in this conference about what we've been learning about connections, civil society, differential effects of crises, and so forth. And you're all working at the strategic level in your cities in a really important areas. So is there a point, a bullet point that's come on to your strategic plans because of this crisis that you're going to be implementing to prepare for the next one? Tough question.
Well, I can try. We will have the elections in April, so there is, of course, a lot of started already in the city and among us politicians already. What we would do differently, what kind of strategic city plan we would do in the next term. So I'm sure there is a lot more to learn because of the COVID crisis than there would be in a normal situation. Well, I think this how to work on different levels and how to really make citizens to participate and that to be real, not just something that is show off. I think that is definitely something we have been trying to learn during this term, how to make participatory approach and how to do it in a crisis when you cannot use the normal setup that you can have a city hall full of people coming, but how to do it differently. There's possibilities also. Maybe those who never participated earlier can participate in this phase, but we need to do very different things.
Great, thank you. And what about you, Christian and Rina, quickly? Do you have any thoughts on the same question? Rina?
Okay. I'm giving Christian a bit more time to think, because this is a very difficult question. It is. I think in Oslo we haven't. I will not say that we started updating our crisis plans because we're in the middle of handling this one. One of the challenges that I've seen here is, or that we have seen here in Oslo, and which I think I haven't seen so much on what Finland has been done, but Denmark has been very much in the media in Norway. And what has happened here is that now we've had, during the whole pandemic, Oslo closed down before the national level. So we had to have our own communication and our own outreach. And then the national level came some days later. The things we have done today is much stricter than what we have in the national rules. That situation is quite challenging when we have to do things locally, and then you have a national level that say that regions has to adapt. The rules are not the same here as in the north or in the west. And this is really, I think this is a challenge for us because it's very difficult to get people to understand what are actually the rules. And then when different rules are communicated on different levels, it's even more confusing for people. So at least I think that might be something that we need to learn from. And of course, in Norway, we're also having a national commission looking into the crisis well, even also the municipal level will be
Great.
Looked after in that.
Yeah, thank you. And Kristen, you get the last word now. Just a few sentences about what you're thinking strategically going forward.
I think one thing is handling a crisis. I think most importantly is long-term on the longer term fighting social inequalities, inequalities in terms of access to the job market, housing market. And I think this really stresses how unfair it is that we have seen over the last couple of decades rising inequality rates. And one of the problems that we face in Denmark is that we have a structure where the municipality does not decide levels of transfer payments for unemployed and very important parts of the health sector. So we have some well, problems in terms of our governance structure as well that we probably have to address.
Great, thank you. And thank you so much to all of you. It's been so interesting to hear your perspectives, your experiences, and we hope to meet you again at another such event in the future. So thank you to all our presenters today. Thank you to you, the online audience. And now I'm going to give the last word over to Christina Springfeldt from the Nordic Council of Ministers. Christina?
Yes, thank you. Thank you, Emily. Yes, I would like to say a warm thank you from the Nordic Council of Ministers to everyone for having joined us throughout this conference week. Normally, this yearly conference is a 1 or 2 day meeting somewhere in or close to Copenhagen. So this format has been somewhat of an experiment, really. But I hope you have found the program and the different sessions as timely and relevant as I have, and that you will continue to participate also in our coming arrangements. And here I can mention a conference on how health, education, and employment play a role in the integration process of young refugees, which will be held on the 3rd of December and arranged by the Nordic Welfare Center. So next year, I hope I'll be able to welcome you all to a conference where we can meet in real and where we can also have coffee and lunch together. I at least really miss those parts of the agenda, not so much maybe for the coffee and the nice food as for the opportunity to meet and to network. But I've understood that many of you also have made arrangements and will see each other after this conference, so that is good. And once again, thank you for having joined us, and a special thank you, of course, to all speakers for so generously having shared your experiences and findings in a rather unexplored field. And also, of course, a warm thank you to the moderators, and finally, Emily and Anna Maria, thanks for all the hard work you have put into this. You really have been the thinkers behind this whole arrangement. yeah, by these words, I'd like to wish you a good weekend, and I hope to see you soon again.
Thank you, Christina. And I'll add as a last word here that many have asked whether the presentations and the content will be available after the conference. And we expect that the Nordic Council of Ministers will have a website with information about the conference, perhaps some of the video content from these sessions, and we'll send the links out to everyone who's registered for this conference. Thanks very much.